So karibuni tena, jina langu ni Dr. Khadija Mbeneka, Senior Resident Obstetrics and Gynecology. Tulikuwa tulifanya video mbili za infertility kwa wanaume. Leo nataka tufanye test ambazo utafanyiwa na jinsi utakavyotibiwa kama uko na shida kupata mtoto. So jambo la kwanza tutafanya ni test ambayo inaitwa semen analysis. Semen analysis ni pale ambapo you'll bring that ile majimaji ya mwanaume ambaye the ejaculate ile mwanaume anatoa ili apate mwanamke mimba. So hiyo ejaculate ndio tutapima vitu kadha wa kadha, na kabla hata tufike mahali ya kupima na jinsi itakavyopimwa, ni muhimu ujue kwamba lazima ichukuliwe inavyofaa. Sababu unaweza ukaenda ukafanya test makosa ikakuwa iko abnormal, labda huko abnormal. For example, kama utaenda utoe ama alafu ikae muda mrefu kabla ifike kwa maabara, hiyo ni shida. Haya, labda utoe uweke katika container ambayo si ndio, like huwa tunafaa kupeana kwa polypropylene cup, yeah. Kuna special containers za kuchukua hiyo maji. Alafu huwa preferably tunaprefer kwamba itolewe na ile kwa kizungu inaitwa masturbation. Lakini hiyo pia na kabla hata ya hapo unafaa kuwa umekaa siku 3 mpaka siku 5 hivi bila kuonana na mwanamke ama bila kutoa maji yoyote. So it's through masturbation, you can do it at home. Alafu body ibebwe in the right container na ifike maabarani, transported in the right way, na ifike within an hour. Na kuna watu wanashindwa na hiyo. So if ukishindwa na kutoa kwa jinsi hiyo, lakini preferably ni inafaa kutolewa kwa maabara. Yani every lab should have, like if it's a serious fertility clinic or a fertility lab, unafaa kuwa na room separate ambayo mtu anaweza toa maji yake hapo. So if not, we advise people to use condoms, lakini condoms si zile condom tu za kawaida. Zinafaa kuwa elastic na zisiwe na ile lubricant ambayo inaweza sababisha kufa kwa zile chembe za mwanaume. Na ile tunaitanga ile coitus interrupters, we don't encourage it during collection of sperm, kwa sababu hiyo maji ya kwanza tu ile ikitoka ndio inakuwa na a lot of concentration, so we don't prefer that. Na inafaa transported in the lab immediately. Tumesema maximum ikuwe ni 1 hour, yani kabla ifike kwa lab. Na I've not seen this in any literature, lakini kuna maabara ambayo inakuambia kama lazima ufanye nyumbani ama utoe yale maji nyumbani, you carry it in your wife's, hapa katikati ya matiti. I don't know how true that is. I've not seen any literature that says that. Lakini should be transported in a container, the right container, as quick as possible. Najua kule tufanya kazi Eldoret, there's a hospital that has a lab next to a room where you can go na bibi yako labda mwingie, you remove your sample, yeah. So kuna vitu ambavyo vitapimwa katika hiyo test. Things like the volume. So kama watu kidogo sana inaweza kuwa it can mean so many things, yeah. Haya. Tutaangalia vitu kama how many sperms are there. So ajabu, I think this might come as a surprise to many, but every 1 millimeter of sperm of that seminal fluid, yeah, your semen, it should not have less than 15 million. Cover every male inafaa kuwa na more than 15 million sperms. So many. Can you imagine 1 millimeter? Millimeter moja. Millimeter ni, if I take my sanitizer and put a millimeter, is like a drop. Almost. So that should have like 15 million sperms, yeah? So you can imagine if you have less than this, then we call it oligospermia or low sperm count. Then out of all these 40%, at least 40% should be moving at the right speed, at the right time. Alafu zinafaa kuwa normal shape, at least 4% of them, not so many white blood cells. So the white blood cells dissipate 1 million per mil, yeah? So if you keep it up, you have serious infection that needs to be treated, yeah? Na pia volume inafaa kuwa at least ikuwe 1.5 millimeters. So if you're, for example, removing very little, then you might not be able to make a woman pregnant. Yes. And then the other things that we'll test in that semen analysis, tutaangalia rangi yake iko vipi. It's supposed to be grayish, off-white, or opaque grayish, yeah? If it's like brownish ama reddish, we'll see maybe kuna infection mahali, maybe umefura epididymis and it's bringing problems, yeah? Alafu pia kama una dawa, kuna zingine pia zinaleta different color huko chini. Then tutaangalia pia pH, pH ya kawaida inafaa kuwa slightly basic, slightly alkaline, yeah, over 7.2 to 7.8 ndio kawaida. If it's increased, it could mean infection. If it is so decreased, it could mean a chronic infection ambayo inakaa kwa muda mwingi. Alafu pale kwa maabara ndio watapima all the rest of the things, then it'll tell you whether it's normal or it's abnormal. Sasa, and then the other thing that we might need to test, so if we see that iko abnormal, maybe we'll tell you to repeat. Labda tukuuliza, have you abstained for 3 to 5 days? Because if you have not abstained for 3 to 5 days, inaweza kuja ikawa iko kidogo sana, ama with very few sperms, yeah. Then the other thing we'll ask you is, what happened in the last 3 months? Are you on any medication? So if you get one sample ambayo itatoka iko normal kabisa, then you won't have to repeat to know that you're okay, yeah. Lakini ikitoka ambayo iko abnormal kidogo, labda iko na low sperm count ama hata 0 sperm count, yeah, then tutakwambia labda urudi after 3 months, which takes like up to 90 days for a sperm to form and mature. Help you kwa sasa. Another thing that we'll do is what we call hormonal evaluation. Tukiona hizi ziko abnormal, then we'll try to figure out hizi abnormalities, what are they reflecting. Unaelewa? Kwa hivyo an abnormality down there could be meaning, probably it could be meaning a problem in the brain, it could be meaning a problem with your hormones, it could be meaning a problem with your genetic makeup. Okay, so tutafanya test za hormones, hizo tutatest hormone inaitwa FSH, LH, testosterone, and other hormones that could contribute to an altered your male function. So we can test other hormones like what you call prolactin, nyingine inaitwa thyroid, the thyroid, yeah, we'll take like the thyroid profile. Kama the thyroid, just one of it kwa your profile, yeah, thyroid. Ikizidi sana, you might end up doing what you call karyotyping. Sababu kuna wengine ambao labda wamekuwa na very severe genetic issues, so you may need to do karyotyping. Haya. Then the other issue is now sasa tumepata kwa na shida. What next? What's the treatment? Yeah? So tukipata, for example, uko just na low sperm count, you might give you drugs to try and, if we might first of all try and find the cause. If you're smoking cigarettes so much, if there's anything that could be causing damage in your body, we tell you to stop, then give it 90 days and see. If not, you can give you other drugs. Kuna dawa ambazo zinaweza zikapeanwa za kujaribu kuboost your sperm production. What happens sasa tukiangalia tupate kwamba labda uko na 0 sperm count. 0, yani hamna. So if you have an azoospermia, inaitwa 0 sperm count, azoospermia, we'll try to investigate imetoka wapi. Inaweza kuwa you are forming normal sperms lakini hazina njia ya kutoka. Labda you are not born with those tubes. What we call congenital bilateral absence of vas deferens. Yeah, kwa hivyo kama una hizo tubes hazitakuwa na mahali pa kutokea, then we'll know and there's still something that can be done about that. Inaweza kuwa labda uko na bacterial infection, maybe we do and we find that you have so many white blood cells, then we'll treat you. Sasa inaweza kuwa pia ulikuwa umefanywa vasectomy kama family planning, alafu sasa unataka kupata watoto, then we'll know what to do. So what happens if, for example, new obstruction, labda ulikuwa umefanywa vasectomy, sasa umebadilisha. Vasectomy ni ile mwanaume kukatwa tube, tulifanya video moja ya vasectomy hapo awali. Ama for example ulikuwa umeblock sababu infection, maybe cause permanent blockage, ama labda ulikuwa umezaliwa bila hizo tubes. So what we'll do, all hope is not lost. So what you can do is that there's a way we can extract sperm directly from the testicles. Inaitwa TESE, sperm extraction. So we can remove the sperms directly from the testicles with special needles, yeah? Hiyo inafanywa tu kwa theater. So you have in a fertility center. Is it done in Eldoret? Yes. Is it done in Nairobi? Yes. I know of centers that do that. So you go and you get it removed from the testicles. Alafu zikitolewa hapo ndio watajua kama watamuingiza tu mwanamke directly, lakini chances of success hapo kidogo. So what they can do is they can just go ahead and do IVF, in vitro fertilization. Ile mnaita test tube baby, yeah, whereby the egg and the sperm are put on a petri dish, then zifertiliziane. Ama ikizidi sana, we can even inject the sperm into the egg just to increase the chances of success. What happens if, for example, you have tulifanya low sperm count, tukafanya hiyo zero sperm count. So what if we investigate na tupate labda we are forming sperm lakini zinarudi nyuma kwa bladder, then kuna dawa ambazo unaweza pewa za kukaza that huo mdomo wa kile kibofu cha mkojo ili zisirudi huko nyuma. If your urine is very clear, mkojo wako hayana shida, yana infection, sperm can also be extracted from that urine, alafu ifanywe nini? Ifanyiwe IVF uweze kupata mtoto. So if you have like low sperm count or zero sperm count, all hope is not lost. It just depends on where the problem is. Okay? Alafu jambo lingine ni, for example, we do and define that you have normal sperm count, lakini unapata ziko very abnormal shape, abnormal movement. So if they are so abnormal, then to increase your chances, we might recommend when ufanyiwe ile IVF. Yeah, hiyo test tube baby. By the cost right now in Kenya, it's around, give or take, 450 to 500,000. Yeah, I know of a center that charges 370,000 if you're paying cash, lakini 450,000 if you're paying via insurance. Yeah, so you see, kuwa mwanaume anakuwa na shida ya kupata mtoto, it's not the end of the world. Yeah, it just needs to be investigated. Ni wapi pako na shida? Ni infection, tibu. Ni labda hana tubes, remove the sperm directly from the testicles. Ni labda amekuwa akivuta sigara sana ama amekuwa akijiexpose na temperature nyingi sana, solve that problem. What we said, ile varicocele, ile increased blood vessels kwa testicles, kama ni hiyo, then surgery, remove them and see after 3 months kama itakuwa imefanya improve. Okay, so all hope is not lost. So men should not like jihurumia, mtu anataka kujitoa uhai nini because you are told that you have abnormal sperm count. No, there are drugs to boost this. Just depends on your problem, and if the worst case to the worst, there is IVF. Okay, that has, the chances and success rates are coming up pretty well in Kenya. Then ikishindikana kabisa wewe, for example, your karyotype is different, it has a problem, and labda kuna other genetic issues that are deep, then no worries. Yeah, kama ni mwambile, it's not your fault. I know it's easier said than done, right? Lakini people need to understand that mtu wajiumbi. Yeah, kama umezaliwa hivyo, so be it. Look for an alternative way. You can use a donor sperm. You can buy donor sperms. They're not very expensive right now in the market. Like in the process that will be expensive near IVF, whether you buy, because of course nobody wants to have like their wife going to sleep outside a pan. That's immorality and all. Like there's that, depending on your religion. Some religions are against donor sperm issue. It depends on how mtasikizana na mke wako. Mkiona you use a donor sperm, it's okay. Lakini it's just in a very few people who have to go through these extremes. Lakini IVF has come and IVF to many problems. So ile IVF tunafanya na ile ICSI. ICSI ni intracytoplasmic sperm injection, whereby the sperm is directly put into the egg, ingie ndani, fertilize, and then it's injected back into the woman as a baby. So I hope that was clear. If you have any questions, drop them down here. Don't forget to subscribe, share this video as much as possible. Do not create male stigma. Do not create stigma. Yeah, children are from God. And if you have any questions, drop it in my inbox. I'll see what we can do. I want to start a Zoom chat room, private, like for different patients because so many people have been telling me and trying to get my number to call me for consultation. Shukran and God bless you.